I'd heard about operations performed using acupuncture needles as anesthesia. David took me to see one at the finest Western neurological hospital in China, Temple of Heaven Hospital.
This is what's called the pituitary cella. This is the area where the pituitary gland sits, and it's enlarged. He's sure that this woman has a tumor smack in the middle of her skull. It couldn't be more central. Okay. And it's very large. 你多大？你可以猜一猜。你给我手看。It's about this big, he's saying. That's a very large.
That's about the size of a quarter.
And what they're going to do is use a combination of some Western medicine and acupuncture anesthesia to perform the whole surgery while the patient is conscious, awake, and able to talk to us. 他们今天要用那个针灸麻醉。
是的。
对，你怕不怕这个？
我不怕，我一点不怕。
They are giving her some, what we would call Western sedative.
Absolutely. And the point here is that she's using less than half of the amount of drug that she would typically use without acupuncture needles. And for many patients, particularly patients at high risk of anesthesia, this has a lot of benefits. Bill, I'm going to try and ask her some questions. 你听我的话吗？
听了。
好，你知道他们在，你知道你在什么地方？
手术室。
是。你舒服吗？
可以。
很好。不疼吗？
不疼。
I just looked into her brain and saw the tumor, and she's talking to you.
They've opened her skull. She has no pain, and they've used less than half the drugs we'd use in the West. This must be very strange to you.
Well, I have lots of questions. The professional skeptic in me says that those herbs work because they have chemicals in them, not because they have qi.
Mm-hmm.
And that traditional medicine is a kind of placebo, the power of suggestion. On the other hand, I've never talked to more credible people than those patients in that hospital and the doctors. So I have mixed feelings. I'm skeptical, but I'm also, well, I'm open, because I think there's something here that might translate back to our society and be useful to us.
Mm-hmm.
But when you got here 12 years ago, when you arrived, were you skeptical?
Very. I had exactly the same questions.
What was your attitude toward traditional Chinese medicine?
It was really very simplistic. Does it work? And if it works, how does it work? And if it works, how much of it is the placebo effect? Is it just people's belief, or do the drugs work? Do the needles work? Does the meditation work? I asked all the same questions that you're asking. And I didn't know a thing about this qi, this vital energy. In fact, it wasn't until I was in the traditional medical college here for months that my teachers finally drove it home that the whole system is based on this odd thing called qi energy. I came here without ever hearing of that before. This is the acupuncture ward, but these people aren't here for acupuncture anesthesia. They're here to treat all their different chronic diseases.
With needles?
With needles. I asked her if it hurt. She said it doesn't hurt, and he said, the doctor said it doesn't hurt.
It hurts me.
It's hard to watch. This woman has what we would call Bell's palsy. It's a paralysis of her face. And this doctor, who's been practicing acupuncture for 60 years, is treating her by putting needles in her arm and her face.
Where exactly is he putting them by his light?
He's putting them in what he calls the large intestine meridian.
I don't understand that.
Well, the body in Chinese medicine is made up of all of these circuits of energy.
So the circuit or the channel from here
circulates through the whole body and is called the large intestine meridian.
Professor, may I ask you something?
他要问你一些问题。
Can you simply explain this to me? These are meridians?
Yes.
Meridians are channels.
Yes.
This is where the needles go.
这是打针的地方，对不对？
There really is nothing like this. I mean, we have the nerve charts, the nerve paths.
This map has almost no correspondence to anatomic maps we use in the West.
So this is a completely different geography of the body?
Absolutely different. It doesn't correspond to nerves or arteries. Their way of finding disease and getting to it is totally different from ours.
How does he know that he's hitting the right point?
He's asking her in Chinese, the qi, which means do you feel the qi? Do you have a sensation? 有感觉吗? She has a sensation. So that's how he knows, and he also has to feel it. You know, my acupuncture teacher said it's like fishing. And you know the difference between a nibble and a bite?
Yeah.
That he puts the needle in, and if it gets a little stuck, if there's tension pulling back, then he knows, even without asking the patient. But, you know, to me, it's an art. It takes a long time.
站吧。
站。
往下没站。
往下没站呢。没站呢。站了。
Did they teach you to do this 10 years ago, 12 years ago?
They tried very hard.
How?
Well, they put me in a room with a teacher and said, memorize these points.
All the points on the body.
Well, and they painted me with iodine dots. I had to recognize all the dots on my own body, then on their body. Then the practice exercise was 10 pieces of paper. If I could put the needle through 10 pieces of paper without bending the needle, then they'd let me near a patient. Until I could do that, no go.
Did you finally learn it?
No. I mean, I got to the point where they let me put needles into people, but I never felt it pulling back. I never felt the chi. It's a very difficult thing to learn.